This is a middle-aged male with a history of pancreatic adenocarcinoma, status post-Whipple, followed by radiation therapy. The patient presented to his doctor's office with worsening lower back pain, for which an MRI was obtained. The images demonstrate an infiltrative T1 hypointense, T2 heterogeneously hypointense, heterogeneously hyperintense mass involving the L3 vertebral body. The axial images demonstrate an infiltrative marrow replacing process extending into the pedicle posteriorly on the right. The lesion heterogeneously enhances with an associated soft tissue component extending along the anterior and lateral margins of the vertebral body. There are post-treatment changes within the marrow spaces of T12 to L2, compatible with previous radiation therapy at those levels. These imaging findings are most compatible with osseous metastatic disease with secondary extension into the adjacent soft tissues at the L3 vertebral level. No pathologic fracture was identified on this examination. On a few of the images, there was extension of metastatic disease into the ventral epidural space without significant compromise of the spinal canal diameter or adjacent neural foramen. Osseous metastatic disease accounts for over 1/2 of all malignant bone tumors. Lung cancer, breast cancer, renal cell carcinoma, and prostate cancer account for greater than 3/4 of all osseous metastatic disease subtypes. The majority of osseous metastatic lesions develop from hematogenous spread. Distribution of skeletal metastatic disease mimics the distribution of red marrow, with typical sites of involvement including the vertebra, pelvis, proximal femur, proximal humerus, and skull.